Senator Alexander.
Thanks, Senator Collins. I want to thank Senator Collins and Senator Warren for their leadership on this issue. They're very diligent members of this committee and have attended all the hearings that we've had on the subject. We've had 5. This is a subject where Senator Murray and I are trying to work together in a bipartisan way to see if we can realize the promise of electronic medical records. Our goal is to put patients first. We want to make sure that these massive changes actually work to do that. We've formed working groups that are bipartisan to achieve that, and as you can see from the attendance at this hearing, there's a lot of interest in it. Today I'd like to use my time to make a statement before I ask a question. I might add that in our work together, we've also been working with the administration, with Secretary Burwell, with the Office of the Coordinator. And my goal, anyway, is to make sure that we implement a electronic health record system as efficiently and effectively and as rapidly as we can in a way that genuinely helps patients. Which leads me to my statement. I believe we should delay until January 1st, 2017, making of the final rules for Stage 3 of the federal government's program to require doctors and hospitals to create electronic health record systems. I believe then that the Stage 3 requirements should be phased in at a rate that reflects how successfully the program is being implemented. I believe also that the modified rules already proposed for Stage 2 of this program should be adopted immediately because it will help most doctors and hospitals comply with the government's requirements. Patients need the interoperable system that we just talked about that enables doctors and hospitals to share their electronic health records. But the government, doctors, and hospitals need time to do it right. Some hospitals have told me they are, quote, terrified by the prospect of Stage 3. These are some of the finest medical centers in the United States, some of those who've been the pioneers and leaders in electronic health care records, some of those who believe that Stage 1 was very helpful in changing the habits of physicians and providers, that Stage 2 was difficult. But even these leaders say that Stage 3 as proposed terrifies them. It does not help patients to make these massive changes fast and wrong. It does help patients to do this deliberately and correctly so that hospitals and doctors embrace the changes instead of dread them. Since 2009, the federal government has spent more than $30 billion to encourage the nearly 500,000 physicians and more than 5,000 hospitals who serve Medicare and Medicaid recipients to establish electronic health care records. About half of these doctors and most hospitals have established such systems. Beginning this year, the government is assessing penalties on those who haven't. About 250,000 physicians have begun losing 1% of their Medicaid reimbursements, and 200 hospitals may be losing more than that. All hospitals and most physicians met the requirements of the first stage of so-called meaningful use program. As I said earlier, most of them thought it was helpful in changing habits. Stage 2 requirements are so complex that only about 12% of eligible physicians and about 40% of eligible hospitals have been able to comply. That's why we should immediately adopt the proposed modifications to Stage 2 requirements so that physicians and hospitals have time to adapt to these huge changes, and that we should delay until January 1 of 2017, making the final rules for Stage 3 so that we can do it properly. I look forward to working with Senator Murray, with Secretary Burwell, other members of the committee and the administration on finding the best ways to modify this program and these requirements so that we can implement the promise of electronic medical records. I would emphasize again, our goal is to help patients, and it does not help them to do this fast and wrong. It does help them to do it deliberately, carefully, and right. Thank you, Madam Chairman.